Haven't given it.
We
yet.
have to.
Right after this.
Good morning, everybody. I'd like to call to order the King County Public Health Committee meeting for Wednesday, November 20th. How can it be Wednesday, November 20th already? Clerk, please call the roll.
Juby. Silva,
Silva is here.
Tarver. Williams,
Williams present remote due to illness.
Young,
Here.
Sanchez,
Present.
Strathman.
Strathman here. And I see Mr. Tarver just joined us. So Mr. Tarver has requested remote attendance, and Mr. Williams, we're sorry you're sick, but shall we let them in? Any objections? Okay, get better, Mr. Williams.
Thank you.
Okay. We have approval of the minutes from September 24th, 2024 and October 16th, 2024.
Madam Chair, can we break those out?
We can, yes, would you like to?
Yes, I move to have unanimous consent for September 24th minutes.
For the September 24th? Okay.
Yes.
Any objections? Okay, for September 24th, you.
I need to abstain from the October 16th meeting.
Okay,
So that's why I broke it out. So
okay.
I will move for a voice vote on the meeting for minutes for October 16th.
Okay. So please.
Second.
Need a second.
Seconds.
Pardon me? What was that last part?
I needed a second.
Okay, got it. Thank you. Thank you. Okay, please call. We got him.
Wait, a promotion. Go, Brett. A promotion.
We're gonna,
Oh,
we
whenever I
separated
get
now.
stuff out, I
We
think, oh,
we need a roll call for the second. So we're gonna do a roll call for the meeting, for the minutes for the meeting on October 16th, 2024. So call roll.
Juby,
Juby abstain.
Silva,
Silva, yes.
Tarver,
Carver, yes.
Williams,
Williams, yes.
Young,
Yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes. Okay. And now we have some public comments scheduled for this morning. I will start with Jean Meyer.
Good morning. Jean Meyer, citizen, Christian. Rugged American, trying to stand for common sense Judeo-Christian values that made this country great. Was not going to speak until I read a Springfield update on bills so radical that I said this. I just want to spit, but I didn't and I won't. Please remember, I'm not a Republican or a Democrat, but I'm a Christian American. A snapping turtle laid eggs in our fire pit this spring. So exciting to see her there laying eggs. Yes, only females lay eggs, while pollutants can cause male turtles to have eggs in their testicles and exhibit female behavior. We patiently waited until mid-fall, having no fires in our pit and reading in colder climates, these precious baby turtles may overwinter in their nest. I reached out to the expert this fall, a state fisheries guy who said it might be safe to have a fire. So we delayed again. Last week, we carefully dug to find empty, leathery shells. Weeks earlier, Mike had found a minute snapping turtle in the back of the garage. He tenderly rescued this adorable little creature, releasing it into the pond. Turtles, many eggs. Few make it to adulthood as nests are not safe place. God designs many eggs for this reason. The human womb was designed by God for a few babies to be the safest place in the universe. As natural mothering instincts, God-given, make the human protect her baby like a goose, male or female protecting their nest. Ouch, stay away from them. The womb, now very unsafe from conception to birth. I want to read a few of those bills that made me growl and want to spit. And I want to just say, in case I get cut off, No Democrats or Republicans, just minds unfettered by those designations. So here we go. Oh, gosh, I'm shaking. Stop. LaShawn Ford, Democrat, and Willie Preston, Democrat, decriminalizes LSD, psychedelic mushrooms, and other hallucinogens, expunges records in violation of controlled substance acts, allows licensing to manufacture these psychedelic mushroom products. That is still in committee. It just needs to be kicked out. Like, come on, guys, this is not what we want for the children of this country. We already got enough messed up adults. Okay, and then this is HB 2, LaShawn Ford, again, Democrat, establishes. Thank you, guys.
Yes, yes, thank you. Good morning. Okay, next we have Lori Powell.
Good morning. I'm Lori Powell. I've been a resident in Kane County for 21 years. And I'm here this morning it's to talk about the COVID vaccine. So it's time for our Kane County Health Department to fully inform our residents of the dangers of the COVID vaccination. October 2024, the U.S. House of Representatives Energy and Commerce Committee issued its report on the Biden administration's handling of the COVID pandemic. $1 billion was spent on advertising alone to push falsehoods about COVID vaccines, boosters, masks, social distancing, and it led to school and business closures enforced on the American people. I've included a link to this 113-page document titled "We Can Do This" PR campaign report, and I have emailed all of you in this room. I've also included a brief overview of this horrible deception of the Centers of Disease Control and the Human Health and Services Department. This fear-mongering COVID campaign was fueled by this PR firm, Fours Marsh Group, and also the American Federation of Teachers, who pushed for prolonged school closures. To further manipulate the U.S. citizens in rolling up their sleeve to receive a poisonous injection, mandates all across the country were illegally forced on us. Chicago was one of the most locked down cities in the nation. This report makes several recommendations. Probably the most important recommendation: Health and Human Services should never again adopt a policy of silencing dissenting scientists in an attempt to create an illusion of consensus in favor of the CDC groupthink. In addition to the propaganda campaign, just this week, the most censored Lancet paper titled "A Systemic Review of Autopsy Findings and Deaths After COVID Vaccine" has been peer reviewed, and I have included a link of that document as well, so all of you can read it. And then I also included an article summarizing those findings. This is a monumental achievement in the face of historically unprecedented scientific censorship. Yes, COVID mRNA vaccines cause sudden death, and most are within the first 2 weeks. That's why these COVID deaths were falsely labeled unvaccinated. Of course, during this vacant pandemic, the Kane County gleefully accepted millions of dollars. And recently, our board members and county employees were excited about the purchase of a building in Elgin. Now, the citizens of Kane County are on the hook to maintain yet another property. I strongly urge this board and our public health department to read these documents and include this information on the health department's website. Our county does not have to be an extension of the very corrupt CDC. Kane County can do better.
Okay, next we have Mike Meyer. You'll also have 3 minutes, Mr. Meyer.
Howdy, Mike here. Hey, I'll put a face on Lori's dissertation there, and I'll be brief. I'm getting spike protein shedding symptoms every time I go visit mom. She's out west. I go out to help her with some senior care things. Every time I come back, in the last 7 or 8 weeks, 3 trips out, 3 trips back. And within a week, I'm running 102 fever, kind of flattens me. So I'm observing symptoms here. It's not simply statistics from the CDC, but I think we're having a problem here. My parents are both, one's 90, one's almost 90. They're quite vaxxed, trying to stay as safe as they can. But it's making other people sick. I would approach endorsing the shot with extreme caution. Thank you.
Thank you. Okay, and then David Young.
Good morning, David Young. I have talked about the Open VAERS report that is still not linked on the website, which I've asked to be linked for a long time. And I just want to go through what the recent reports are. Over 5,000 miscarriages. This is due to from the vaccines, mRNA vaccines. Over 5,000 miscarriages, over 22,000 heart attacks, over 28,000 cases of myocarditis or pericarditis, 72,000 permanently disabled. Over 40,500 life-threatening illnesses, over 47,000 severe allergic reactions, over 16,000 shingles. So I just wanted to bring this to everyone's attention. It's there. It's a link I've sent before in the past, and I'd like to see this information be on the website because it is. This is actually reported from the CDC website itself, and the numbers are reportedly fairly accurate, but quite honestly, they're actually very low. They're probably a lot higher than what's being reported. So I don't know why we don't do this and let our citizens know about the potential problems that can occur from taking these vaccines. And on a personal note, Friday, I had to go to the urgent care because I couldn't breathe. So they gave me albuterol, I think it's what it's called, albuterol. It helped a little bit. But then I was having a hard time sleeping, breathing, and I remembered that I do have ivermectin, and along with what they call Z-Stack. Dr. Zev introduced this during COVID. It was the Z-Stack with ivermectin, and I got to tell you, took it on Monday. I took another dose this morning. I'm not using that inhaler now at all. Before, I was actually waking myself up because I couldn't breathe over the past, well, on Sunday night, Monday night. Then I started taking it Monday. So just, I know that that's me and that might be anecdotal, but those drugs are available. They're cheap. They work. You use it with zinc. You use it with this Z-Stack that Dr. Zev Zelenko developed, and it heals people. I mean, I'm going to be able to swim tomorrow morning, and I'm not going to be able to, I usually swim Tuesday, Thursday mornings, and now I'm going to be able to do that no problem. So I'd like to see this stuff be put onto the Kane County Health Department website. Thank you.
Okay, thank you. Okay, and now we will to animal control this morning. Good morning.
Good morning,
Mr.
everyone.
Brett
How are you?
Youngstead.
I am very short this month. All my reports are on file. If anybody has any questions, please let me know.
Do we have any questions? I always find it very interesting to read your reports, and I noticed the big differences between 23 and 24 for the totals. And it must have been from that one hoarding event that was up in Algonquin.
Yes, that was the big intake last year, and also the change in our euthanasia numbers. When you bring in 105 cats from a hoarding case, it's never going to go in your favor sort of moment. So that skewed our numbers a little bit last year.
Yeah.
But yes, so those are unfortunately why the numbers are so high last year.
They really fluctuate though. I just find it really fascinating to follow them and see what's going on. So,
Thank you.
okay, any questions? Okay, then we'll talk to Executive Director Michael Isaacson. Good morning, Michael.
Good morning, everyone. And I just have a couple slides to share today. And really, I want to highlight some exciting things that have been going on around the health department, starting off with the first one, which was last month. Director Onwuda and her team April and Claudia and the rest of the group hosted a very successful communicable disease conference. So you can go to the second slide if you would, please. So this was a packed house with infection control folks, nurses, students, people from our school districts. I just grabbed a couple of slides. This is actually a nice video that's on our Facebook page. So again, I encourage you to follow us on Facebook if you don't already. But I'd open it up to Director Onwude if she's got anything she'd like to share, because it was just a phenomenal event and it's an annual event, and I think it keeps getting better every year. So kudos to the team.
Yes, it's getting better every year. We started off initially with just the infection preventionists from the hospitals, sharing data with them. And when I came on board, I decided to open it up, and we've grown ever since, every single year. Now we're offering CEUs to nurses that attend. So it's really very popular. It's a partnership with Aurora University. So we really had fun on that day. Lots of information shared by IDPH, our staff, and the community. It's great.
Very good.
Yeah. And I want to give a shout out to all the attendees as well. And as we talked about at that event, there's a lot. We were talking before the meeting about different bird flus over the decades, and there's a lot of bacteria and a lot of viruses out there that make people sick. And whether you're talking about infection control in hospitals or the folks in the schools who are keeping people safe, there's a lot of people in the community who work together as a system in partnership with the health department to really do that work. And so it's vital. A lot of it happens behind the scenes, but really appreciative of all those folks. Next slide, please.
I just want to say
Yeah,
that
please.
I think some of us who aren't involved with that take it for granted that it's gonna, that it's gonna be done. And when it's not done, then we realize how hard people work to make it happen. So thank you for that.
I also just wanted to give a shout out. We do have a podcast that the health department puts together. So this is something that Director Peterson and her team works on, and they do a fantastic job. It's another medium that we can use to reach the public with good health information. This is Lung Cancer Awareness Month. And so this month, our newest episode is with Hillary Knowles from Rush Copley. So Maria and Lorena from our team do a great job in this interview. But again, I've put the link there, but you can go on Spotify and just search Kane County Health Talk and it'll come right up. We have over a year now of episodes that have been posted on a whole variety of subjects. So again, this is just an effort to use different technology to get information out to people. But I don't know, Kim, anything else you want to say about the podcast or this episode or anything?
No, I think that pretty much sums it up, but we do take topic requests from the public and our partners, and we try to just stay on trend with the most up and coming topics. So if people have suggestions, feel free to email me and we can, talk about having that as a topic. And we do everything from, early childhood, prenatal health, that all the way to, mental health, behavioral health, lung cancer, kind of everything we can cover in public health.
Excellent. That just sounds like another great way to communicate all that needs to be done, right? So, great. Yes, David Young?
Yes, David, how many people listen to that? I guess you just started this first podcast. I mean, you just started the podcast. And so how many people actually listen to it?
Question.
Just curious.
Great question, David. We do track those analytics, but I have not looked in a while, so I will get back to you on that.
Okay.
Yeah, that would be really interesting to see. Good question.
And actually, I tried to look before the meeting last night, but I couldn't find online where that's posted. But we have that regular report. We can share that information. And then finally, I'd just like to highlight one thing that we have talked about, and this is something not only with the new facility in Elgin, we like to be able to expand our outreach, but in general, the health department has historically not provided much in terms of services for seniors. So we work closely with Age Guide, we work closely with Senior Service Association, but we directly haven't done a lot. So if we can go to the next slide, Blair. We do have a event coming up in partnership. This is an online event. And I hope this is really the start of the health department really engaging in different ways for how we can support those organizations. And again, this is our model, is always to look at how we can support organizations who are already out there doing the work. But we know we have an aging population in this community. So we want to figure out what are the things that we need to do to help people age in place, to help people have access to the services they need, to help people make connections, because we know being isolated is an incredible health risk for people, especially as we age. So this will be a webinar that we have coming up. It is free. You can go to our website and register for that. I'd like to shout out Tina Corral, who is, I believe, online right now. So I don't know if Tina has anything she'd like to say. She may just be on YouTube, so she may not be able to speak. But this is really exciting, and stay tuned, because we plan to offer a lot more. And once we're up and running in Elgin, we want to be able to offer classes and be able to really bring people together for that sense of community with our aging population.
Great, great. Any questions? Yes, David?
Okay, David Young, so that conference you had talking about at the very beginning, how many people attended that? You said it was a packed house. Where was it again?
It was at the Judicial Center in the jury room.
Yeah, we were at full capacity. I believe we were about 80. Yeah,
Okay.
that was as much as the room could take.
All right, thank you.
Okay.
Madam
Yes,
Chair,
Dr. Silva.
it's loosely related, but I want to take the opportunity to give a plug to Elgin Township because they have a program where people from the community can donate animal food and then the seniors can come and pick it up. So I'd love to promote that, continue to promote that with other organizations. And it's sort of a feel-good situation that takes a little bit of a financial burden off our seniors. Thank you.
They do food as well, but they also do the pet food, which is great. Has to be unopened, but it's great, great service. So, okay, I guess we're ready to move on to resolutions. So I'd like a motion and a second for resolution number 24-3218 for discussion.
Carver moves.
Tarver moves, and a second.
Sanchez seconds.
Sanchez second, thank you. Mr. Isaacson.
Great. So this first resolution is authorizing Kane County to accept a grant from the National Association of City and County Health Officials. It is for the adaptation, of Project First Line tools and resources by local health department grants. So this is actually nice complementary funding to another grant that we've received to help us do outreach to long-term care facilities so that we can provide additional training and support. Those are the populations. Again, this is another area where we can help the aging community, but this is really exciting. So again, kudos to Director Onwuda's team. I don't know, Chase, or anything else you want to say about this one?
Yes, so as Michael mentioned, earlier in the year, we had a nature grant that offered us the opportunity to train on infection prevention control for our staff. So this time, they also offered us this one based on our prior experience with them. Obviously, it looks like my staff did a good job. So the reward for good work is more work. So this grant actually helps us because post-COVID, we realized that most of our problem was in the long-term care facilities. So we're helping them to improve their infection prevention control programs, and then, have a team from the health department that goes out to these local long-term care facilities on a regular basis, offer them support, tools for infection prevention control. We hope to buy a machine that would actually help to, it's called an ATP machine. You use it to censor areas that need more cleaning. So this is we're really looking forward to working with nature on this one. And also it's a collaborative, so we'll be getting more tools from Project First Line.
Excellent. Any questions? I have a question. I think that's excellent. I worked in a senior care for a while and I know how difficult it can be for the staff to keep things in a good way. Will you be, will they know that you're coming when you're coming to them? Will you announce it? Is it scheduled or you just show up?
So what we learned from the previous grant, we went out to Virginia and we toured the health department that had a really good infection prevention control with long-term care facilities is, we're not coming in from a regulatory perspective, but to help them to, improve their
Yeah, that's a
program.
big
So we want them to rely on us to call us whenever they have questions. Or what we noticed was attrition in long-term care facilities. They're really, really challenged with keeping their staff. So every time they have new people coming in, not well trained, they're trying to catch up on their work. So, so we'll be like the steady hand for them to go back to obtain information, on infection prevention.
That seems like a much better approach. I understand that. That's good. So any other questions or comments with that?
And I'll just add, that's our approach with everything. So we regulate food establishments, but we're not there to surprise people and try to play gotcha. We're there to work in partnership and figure out what are the resources, what are the tools, what's the education needed to make it safe. So we're never out there trying to shut people down or
Yeah.
zap people. We want people to succeed.
That's a good approach. That's a good approach. Mr. Kenyon.
I belong to a health club. It's now LA Fitness, but we think you people should come in and inspect the facilities.
Okay.
The showers are not cleaned. Anyway, my friends tell me all that. They worry about the wrong things. I mean, cleanliness, that's what chases people away.
Yeah. I mean,
You could do it. I'll be there come after 5:30 and then I'll be there waiting for
yes, sounds good.
And that was 5:30 a.m. I'm
Yes,
sure.
That's perfect. Perfect. Yeah. And there are limitations legally on where we have statutory authority over things. So,
They don't know that.
okay.
If you walked in there and looked at the bathrooms and say, these have to be cleaned,
Yes.
they would clean them.
Very good. Very good.
Very good point. Okay, so any other questions or comments about this? Okay, please call the roll.
Shuby? Shuby, aye. Silva? Silva, yes. Tarver?
Carver, yes.
Williams?
Williams, yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes. Okay, it passes. Okay, the next resolution is Resolution 24-3222. And I'd like a motion and a second and then discuss.
Carver moves.
Carver moves.
Silva seconds.
Silva seconds. Thank you. Mr. Isaacson.
So this is authorizing the execution of naloxone dispensing agreements between the Kane County Health Department and various county organizations. As part of our comprehensive effort to reduce overdoses in the community, as you all know, we work very hard to get naloxone out to as many people as we can to get people trained. This is a life-saving medication that is safe and it's really critical to keep people alive so that hopefully someday they can recover and not have the burden of substance use disorders, or in many cases, people may be using something that they don't realize, for example, has fentanyl in it. And so we see people overdose the first time that they're using something. This is really an effort to streamline our process here. So I have heard some people talk that maybe board meetings are getting long. So we keep bringing resolutions forward with each individual agreement. We've worked with the state's attorney's office to say, okay, can we stop doing that? And as long as, will you give us permission that as long as we have a state's attorney approved agreement that we can go ahead and move forward? So if we're going to put a new dispensing mechanism in a library, we don't need to create a resolution, that we can simply move forward with that.
So that would be the same reason why it has the other language in there about something other than naloxone.
Yes, right.
So that in the eventuality that there is something else.
Yeah,
Well,
as
that
long
makes
as
sense.
everything is, I mean, naloxone is definitely the primary focus
Right.
for this. But it's still, everything would be reviewed by the state's attorney's office. Typically, when we bring things to the board, if we have contracts that there may be language issues, it's around indemnification. So if that becomes an issue, we would still bring it to the board. But otherwise, if the state's attorney's office signs off on it, we'd be able to move forward. And they included some sample information.
That makes a lot of sense. Any comments or questions?
Madam Chair Williams,
Yes, Mr. Williams?
Mr. Isaacson, do we have any data on how often naloxone is used in Kane County on an annual basis?
We have different pieces of data, Mr. Williams, and the way it's a little bit incomplete, we know the naloxone that we directly distribute. And we do have a mechanism where we request that people share information when naloxone is used. So with our police departments who 10 plus years ago, when we started this program, we have information coming in on a regular basis from our police departments when they utilize naloxone. However, and so we can certainly share and we can provide a full reporting on that. However, if someone administers naloxone to their friend and potentially saves their life, they may not report that to us. So that's the only caveat that I would say that we don't have 100% understanding of how much naloxone is being used. But we certainly can bring, and I can bring that next month or even send it around, a listing of what is reported to us. Typically, I want to say last year we had about 80 saves that were reported to us, but I'll send you the information that we have.
Thank you. That would be.
It was that 80 saves beyond the police department?
Including police departments.
Okay, okay. Well, it would make sense to me that people wouldn't report it if they're helping a friend, you know, being afraid that that part would be reported as well. So, but it would be interesting as you restock these vending machines to get that data as well.
Right.
So, any other questions or comments? Okay, please call the roll.
Doobie? Doobie, aye.
Silva?
Silva, yes.
Tarver?
Tarver, yes.
Williams?
Williams, yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes. Okay, it passes. Okay, can I have a motion and a second to discuss and possibly pass resolution 24-3224?
Silva moves.
Sanchez. Tarver seconds.
Okay, we got Silva and Sanchez on that one. Thank you. Mr. Isaacson.
So this is a resolution authorizing acceptance of a new grant through the Illinois Children's Healthcare Foundation. And this is to enhance children's health through the formation of family-run organizations. And this really is a natural next step for us with our children's mental health grant that we've been working on for the past 5 years. So we're really excited to get this, and Marie Leone and Director Peterson did a good job putting this together. Actually, this Friday, one of the parent groups that we support is hosting a meeting at the St. Charles Library. So hopefully hopefully all of you got an invite to that directly from them. But as we look at behavioral health in the community, one of the big issues is how can we support families? And it's really important to us, and it's really important as using this model of a children's system of care, mental health system of care, that parent voice is big. And so we always are looking at ways that we can give more voice to families. And so what we're doing here is, over the past several years, we have directly supported parents. We have lifted them up. We have provided training. We have provided stipends for people to be able to attend meetings and participate in community work. Over the next 18 months with this grant, what we'll be doing is actually launching a standalone organization that will be separate from Kane County government and will be a formal family-run organization that is its own entity that's run by parents, that is parent voice across Kane County. So I don't know, Director Peterson, anything else you want to highlight for this?
No, just
We have audience approval on
Yeah.
that.
Thank you. We are so thankful for these parents. They have really just, you guys heard a presentation from them before. They have become really solid leaders, and a lot of people in the community know to go to them when they're struggling with parenting issues. And also parent support has been shown to really reduce things like child abuse, which we know was kind of spiked during COVID. So this is just another way to really prevent those cycles of trauma, generational trauma that go on in families, to break those cycles. So it's just really important work, and I hope you guys can attend. And if not, we'll just keep you posted on all the work that comes from this. And I'm so excited to see them actually have their own organization at the end of this, that we can partner with them and they can be stood up on their own. So thank you.
If the committee remembers, we had them come and present to us, and they were a pretty impressive group there. I look forward to seeing them on Friday. So,
And it's Friday at 10 a.m. at the St. Charles Library.
okay, any other comments or questions? Okay, please call the
Madam
roll.
Chair, can I ask a quick question?
Yes, Mr. Tarver.
Thank you, Madam Chair. How will parents be notified? Is this working through our physicians, our local hospitals when there's situations? How do parents that are not involved become aware of the programs and resources that are available?
Excellent question.
Sure, thank you. Right now, it's a mix of, we really advertise their parent cafes online through social media as well as our website, and just through networking among the community members. So all the parents kind of split their hours and go to most of the community events around the county and have a table. So there's a mix of mediums that we use. We would love to get more involved with doctors and in different medical organizations, because I think that would be a really direct route to the parents. It's just really hard to get in there and promote these things when they're already so busy. So again, any ideas with that, let me know, and we'll just continue as the work increases to increase our promotion of the work. And again, they do a pretty good job of getting out there and promoting their own work and their own services and their own experiences to folks in the community in both Spanish and English.
May I ask a follow-up question?
Sure.
One of the responsibilities that I work with in our school district here in DuPage is I work as a hospital liaison. And I know that a lot of the area hospitals who have school liaisons, would that be an avenue that you could reach out to inform them so that when they have new situations or new families that are entering any one of those programs, that they could be made aware of resources are available in the county?
Absolutely. I'm not sure how that would work. If there's a meeting that we can come to and talk about it, and any type of situations like that, we would love to do that. Or we can send materials and other information about the program to you to pass on. So if you want to just email me and we can kind of talk about that further, that would be great.
Wonderful. Thank you.
Thank you.
That would be great. That would be
And
great.
I will add, with the part of the genesis of this work is probably about 10 years ago, in work with the school districts, we would meet regularly with the directors of student services. And the Mid-Valley Co-op still hosts a meeting where we have talked about the hospital liaisons and how we can better connect people. And it was actually through those meetings that we started to conceptualize the whole idea that ended up eventually becoming the Illinois Children's Healthcare Foundation grant that now is a 7-year grant that we've been successfully implementing with our community partners. So I think, Mr. Tarver, your question is like an alpha omega question. We can circle back to that, and it's really, you're referencing kind of the genesis of a lot of this work was around that very component in the school districts.
Very cool. Very cool. Okay. So we are ready to take the vote then. Any other questions before we do that? Comments? Okay, take the vote.
Juby?
Juby, aye.
Silva? Silva, yes. Tarver?
Tarver, yes.
Williams?
Williams, yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes. Okay, it passes. Okay. Do we have any old business? Oh, yes, Mr.
I just want to, I know he's getting there's probably much fanfare and celebrations for Mr. Kenyon here and over the last week, but I just want to personally, on behalf of the health department, thank him. Been on the board for a long time, and he's really been a champion of the health department, and also asks us hard questions and asks us to look at things in different ways. And personally has been very helpful for me in learning and growing in my career. So just want to thank him for all of
At
his
my
time.
age, I should be conscious of what you people do.
That's right. There's a lot of you people today, but we'll, yeah. So thank you. To work with Dr. Silva in the coroner's office. So hate to lose her on the
But if
board,
she
but
gets a
glad to
2 o'clock
continue that.
call.
Yeah.
Thank you so much.
Okay. So may I have a motion and a second to place the reports on file?
Silva moves, please.
Dr. Silva moves,
Carver seconds.
Carver seconds. All in favor of that?
Aye.
Aye.
Thank you. Okay, don't think we have any need for an executive session. I would just like to say this is my last meeting of this session of Public Health. I don't know if I'm going to be back next month, but with the new group, but I hope so. I want to thank you all for sitting on this committee these last 2 years. We've accomplished a lot. So thank you for doing a good job and stepping up and helping the community and educating the community and reaching out. You've done a fabulous job, and you guys rock. The staff at you've done good, Michael, putting together a fabulous staff. So thank you very much. And I need a motion to adjourn.
Juby moves.
He sit here, nobody wants to leave.
Okay, all in favor?
Aye.
Aye.
And I also
We were
want to
waiting for Mr. Kenyon.
Right.
Yes.
Exactly.